Many of our patients here at PRI suffer from symptoms of debilitating depression, a depression that's considered treatment resistant. They've likely tried many different forms of treatment and medications that may not have worked or may no longer work for them. Electroconvulsive therapy, or ECT, is an effective treatment for a variety of mental health disorders, including depression, bipolar disorder, and schizophrenia. ECT is a procedure that can be safely administered on an outpatient or inpatient basis. When medication or other typical treatments don't seem to be working as well as we would like, electroconvulsive therapy may be recommended. In the case of major depression, ECT can be more effective and work faster than antidepressant medications. ECT may not be appropriate for all patients with mental illness, and the decision to use this treatment is made in consultation with a psychiatrist who has training in and experience with ECT. ECT should not be considered a treatment of last resort, but rather one of several treatments that may or may not be appropriate for a patient. In the simplest terms, ECT is the use of seizure activity for therapeutic effect. In a very controlled and highly monitored setting, a seizure is induced. While the exact mechanism of action remains unclear, it's thought that with a seizure, a number of chemicals in the brain, called neurotransmitters, are stimulated and released, and this may result in the positive response to treatment. ECT is usually administered in a series, 3 times a week, and the number of treatments administered in a course is between 6 and 12 treatments over a period of 2 to 3 weeks. It's important to remember to follow the specific instructions of your physician if undergoing ECT as an outpatient. This includes not eating or drinking anything after midnight the night prior to your procedure, and not driving on the day of your ECT treatment.
Let's take a look at how ECT is actually delivered in PRI's Interventional Psychiatry Suite. As you can see, ECT is delivered in a specialized treatment area with equipment that monitors vital signs and heart activity. A cuff is placed to monitor blood pressure, and a probe is placed on the finger to monitor oxygen levels in the blood. Electrode leads are placed on the chest to monitor seizure activity through an electroencephalograph. The patient will have had nothing to eat or drink for at least 8 hours prior to treatment. At the time of treatment, you will be cared for by our experienced treatment team, which includes specialists from psychiatry and anesthesiology and skilled nurses. An intravenous catheter, or IV, will be placed. This allows administration of medications that make ECT safer and better tolerated. After being moved into the treatment room, additional leads are placed on the forehead to monitor and record brain waves and seizure activity during the treatment. Once this is in place, the anesthesiologist will administer a medication, one to help the patient go to sleep and another to help stop voluntary muscle activity. It is important to note that this sedative medication helps ensure there is no memory of the procedure. Once the patient is asleep, a second medication is administered. This medication relaxes the muscles so there will be no significant convulsive activity. It is surprising to many to learn that the seizure caused by ECT doesn't cause the violent shaking of body and limbs that occurs with the grand mal seizures of epilepsy. The staff anesthesiologist is trained to recognize problems with blood pressure, heart rhythm, and breathing, and intervene should any problem arise. Complications from ECT are rare. Following the procedure, short-term minor side effects may include headache, dizziness, nausea, muscle aches, and confusion. As blood pressure can rise significantly during a seizure, a blood pressure lowering medication may be given by the anesthesiologist. This helps make ECT a safer treatment, especially for those patients who may have underlying medical problems. When the muscles of the patient are relaxed, the anesthesiologist will provide oxygen to the patient with what is called a bag and mask apparatus to help the patient breathe. This helps ensure that there is adequate oxygenation throughout the seizure. Right before the ECT stimulus is delivered, a mouth guard or bite block is placed in the mouth to help protect the teeth. After one final check to make sure everything is in place and ensuring the patient is under anesthetic, the team will apply electrodes to the patient's scalp in specific locations. A psychiatrist then initiates the stimulus, which delivers a relatively small dose of electricity through the brain, inducing seizure activity. As I mentioned previously, a muscle-relaxing medication is used so there is very little convulsive activity. Seizures are considered optimal if they last more than 20 to 25 seconds and will be terminated with medication should they go longer than a few minutes. Once the seizure has ended and the anesthetic medication wears off, the patient begins to arouse. He or she may be confused initially, as they just had a seizure and has undergone anesthesia. This confusion may take a few minutes to clear. Patients are kept in the treatment area for ongoing monitoring and given more oxygen until the patient is awake and stable. This recovery period is usually about 1 hour. Once the patient has recovered and been released by the anesthesiologist, the patient is discharged back to their hospital room or is discharged home in the care of a family member. The patient might be given acetaminophen to help with short-term headache pain and generalized mild muscle pain.
Most ECT is delivered to patients who are not admitted to the hospital, in other words, outpatients. It's important to remember to follow the specific instructions of your physician if undergoing ECT as an outpatient. This includes not taking anything by mouth the night prior to the procedure and not driving on the day of ECT treatment. Evidence shows that ECT is highly effective and is used to achieve rapid improvement of symptoms when other treatments have failed, or for the use of life-threatening conditions with severe depression, catatonia, or suicidal ideation. For many patients, the positive effects of this treatment are long-lasting.